For many years, the specialty of sclerotherapy in the United Kingdom lagged way behind the rest of the world. But all of that changed with the formation of the British Association of Sclerotherapists 20 years ago. I'm super excited today to have a chat with Emma Davis, who was the driving force for the formation of the British Association of Sclerotherapists. Let's dive in and find out how the British Association of Sclerotherapists came to be, what developments Emma and I have been involved in, and what Emma has gone on to do since leaving the BAS. Well, Emma, I wanted to talk to you because you may not know, you may not remember, but it is now the 20th anniversary of the first BAS meeting. Did you know that?
No, time flies, doesn't it?
Yeah, it does. We had the first BAS meeting on the 14th of May 2005. And the next meeting of the BAS, the British Association of Sclerotherapists, is on the 20th of May, and it will be the 20th anniversary. This association that you set up...
We did.
We did. Yeah, we did. But I have to tell you, I think really you need to take most of the credit. I was in your slipstream. I was very fortunate to have met you a few years before, and you really were the driving force for the BAS. You won't. You're too modest to acknowledge that, but
Well,
I will say.
it is something I wanted.
Yeah.
I loved microsclerotherapy, and when I met you, I learnt more and more about varicose veins, and I just thought I'm so privileged to be working with a vascular surgeon and meeting all the other vascular surgeons, because you dragged me along to venous meetings, and I just thought aesthetic practitioners like me who are practicing microsclerotherapy need to have that connection too, and that's why I talked to you about having an association that joined the two up.
Well,
and you helped me make it happen.
Well, I think it was a good synergy between the two of us, because when I was appointed as a consultant surgeon in the NHS in 1995, I obviously had been trained to a very high standard on how to treat venous disease, up to the point of spider veins. I knew nothing about spider veins. I could treat varicose veins, I could treat reflux, I could treat varicose eczema, leg ulcers, deep vein thrombosis. I knew all about that. But the very small veins, the spider veins, I knew nothing about. And of course, when you get appointed as a consultant vascular surgeon and your major interest is also vein disease, you inevitably get people asking you, can you treat spider veins? And it was a glaring gap in my knowledge and expertise. And it was very fortunate for me that you were in the area treating spider veins. So I reached out to you first. You may recall that you were practicing in a beauty salon in those days.
Yeah, I remember that call very well, because my daughter picked it up, didn't she? And she said,
yes,
Mr. Car crashes on the phone.
Mr. Car crashes on the phone. Well, I reached out to you because I knew that I needed to watch somebody doing spider veins. I needed to talk to somebody who did a lot of spider vein treatment and get the hang of it. And you were right on the doorstep, and so that's why I phoned you. And of course, we understand now, but we were only learning at that time, that there's a very strong link between spider veins and bigger veins and reflux and more serious conditions. Yes, we started going to various meetings together and complementing our knowledge and learning together. It was a learning journey. And my recollection, and it is a bit hazy because there was so much going on at that time, my recollection is that you and I went to Bologna.
Yes.
To see Alessandro Frulini's meeting on sclerotherapy in Italy. And I've done a recent podcast with Alessandro and caught up with him. I told him the story of you and I in the audience learning about all sorts of venous disease. And of course, they treat a lot of spider veins by sclerotherapy. And because we learnt a lot, didn't we, Emma, about
Yeah.
the association between spider veins, reticular veins, reflux, and more serious problems. And I think it was you that said, do you know, we don't have anything like this in the United Kingdom. We don't have a forum in which doctors and aesthetic nurses, principally, and aestheticians can all meet to share knowledge and to collectively improve the practice of sclerotherapy. Because it was the Wild West then. It still is to a certain extent, isn't it? Sclerotherapy, microsclerotherapy anyway. So yes, it was you who was the driving force. You had that vision of let's set up a sclerotherapy association and let's set up some meetings in the United Kingdom. I've got something that you might find really interesting. I had a dig through my filing cabinet, Emma. I'm going to share something with you, and let me see what you think of this. Now,
Oh, wow.
can you see it?
Yeah.
Yeah.
I can't read it, but I know exactly what it is. Yes.
Yeah, it says the first meeting of the British Association of Sclerotherapists will take place on the 14th of May 2005 at the Wokefield Park Conference Centre in Reading, Berkshire. And at that time, we started at 9 and we finished at 5. And I introduced the association at 10 o'clock. You were very modest at that time, Emma. You never appeared on the programme, but you put the programme together. And it was an interesting programme. I look back at it now and I think we could certainly copy that programme and have updates on all of those topics. But I thought I'd share it with you because it really is a bit of nostalgia.
Yeah.
The first meeting of the British Association of Sclerotherapists. And we got that meeting recognised by the Royal College of Surgeons for CPD points. It was the first meeting of its kind in the United Kingdom, specifically and exclusively looking at the role of sclerotherapy in the modern practice of venous disease. I was just blown away by that. It's extraordinary.
Yeah,
Extraordinary.
good. That's a very, quite a strong and very proud memory that we made that happen, and it's gone on for 20 years.
I mean, I think it's just a testament to the importance of sclerotherapy is increasingly recognised now. And not only microsclerotherapy, but liquid sclerotherapy and foam sclerotherapy now is a major part of UK practice. It's still not given the recognition it deserves, and it still doesn't have its place up there with endothermal ablation. But the BAS continues to work on that.
But can I ask you a question, Haroon? Do you think that because when we met, I think it was quite common for surgeons treating venous disease not to be interested in treating thread veins?
Yes.
And it's my experience, and I don't know what you think, when patients come to see me and they've got lots of lumpy, bumpy varicose veins, it's not the varicose veins that concern them as much as the thread veins. So I wonder if surgeons have got more interested and confident in treating the tiny ones, or whether it's too fussy for them still and they'd rather either refer them on or just not treat them.
That's a very interesting question, and I don't know the answer to that. Obviously, when I go to meetings, I'm meeting people who are interested in all aspects. If you said to me, what is the practice nationally? I don't know. I certainly did when I was practicing. I closed my clinic 2 years ago now. It was very common for people to come to me and say, yes, it's the spider veins that worry me. You're quite right. That's what the public are focused on to a large extent, and they either are not aware about the varicose veins or they're not so concerned. And certainly spider veins, if they're very prominent and widespread, they will attract more attention than some small lumpy bumpy veins. And I don't think the public puts them together. They don't associate the two. They don't see that they're associated. And I think you're right. I think certainly in my practice, it was quite common for me to be referred saying, I've seen a specialist, both NHS and private, and they say there's nothing that can be done. I think that's probably a shorthand code for it's a bit too fussy. Yeah. I'm not going to do that. Yeah, I think that is probably widespread in the United Kingdom. I think it's changing because access to NHS treatment is very difficult in the UK. And of course, people accept that spider veins are not covered by the NHS anyway, so they will seek private treatment. And I think doctors now and vascular specialists are cottoning on to the idea that microsclerotherapy is an important part of their practice. I was talking to a colleague recently who in fact is going to be presenting at the next BAS. He says that spider vein treatments makes up 50% of his private practice.
I can believe that
Yeah.
they're much more of a motivator to seek treatment. And unfortunately, I think it's hard for me to judge just by my own practice, but it's still the case that people do not know that they can have their varicose veins treated non-surgically with walk-in, walk-out procedures. They're still imagining it's an operation they have in hospital. So that's another barrier for them. When I say to them, you need to get your varicose veins treated first. Oh no, I don't want to do that. They're not bothering me that much. And then when I explain that they can get them treated non-surgically, their faces light up a bit.
Yeah, definitely.
Yeah.
So you're still doing microsclerotherapy, Emma?
Yes, I am. It's one of my favourite treatments.
It's very satisfying, isn't it?
Yeah. I find it quite meditative as well, because I've been doing it so long now. I think my hands know what they're doing, even if my mind is wandering. And the patients tend to be quite relaxed as well. Not all of them, but most of them.
And do you have a link now with a vascular surgeon so you can get a second opinion?
I don't, but what I do, because now that you're not around, I don't know the clinics very well. So I will give them a list of the clinics locally in Bristol and let them go and choose. I probably should make an attempt to have a meeting and find out more about the services I'm sending them on to. Or I say do a Google search and tell them what to search for, because I don't want to be responsible for poor service or poor outcomes based on my recommendation. So I could refer to you confidently because I know exactly how you work, because I used to work with you. But yeah, I can't recommend people I don't know and I haven't seen their work.
Yes. No, I share your concerns. I'm still getting people contacting me saying, where can I have veins treated? Where can I have my spider veins treated? Hand veins, facial veins. I hesitate to recommend somebody that I don't personally know. And I do feel that when we set up the BAS, one of the motivators was to bring together those who treat bigger veins and those who treat smaller veins so that they could get to know each other and form a network locally. And I think that's probably one of the things that still needs to be done, yet 20 years later. We haven't really accomplished that.
We were training people for a good few years, and I remember in our training manual we said shake hands with a local specialist, and I haven't followed that advice myself because I've lost you, and there's a grieving period where I have to I have to adjust and pick myself up to find and meet somebody.
Yeah, it's difficult. I think that is one of the strengths of the BAS is that it's a forum where people can meet, both doctors, aestheticians, aesthetic nurses, nurse prescribers. I think that's something we need to strengthen on. You and I, we set up the first hands-on microsclerotherapy course. Now, I'm not quite so sure about the date of this, but I think it preceded the BAS.
Yes, because when we decided to set up the training, because when we had a chat about our own experience and our own training, we were very much aware that it had been completely inadequate. You know, I'd learnt more because of you, you learnt more because of me. And what we both started off with was quite poor. And when we started writing the training manual, I remember you saying we should get this reviewed by other specialists just to make sure we're not missing anything and that it meets a standard. And that's how we built relationships with some other surgeons and companies.
Yes, definitely. And those associations continue. For example, the first president of the BAS is still the president, Philip Coleridge-Smith. He affectionately refers to himself as a phlebosaur.
What does that mean?
I think it's a hybrid between a phlebologist and a dinosaur.
Yes.
A phlebosaur.
Well, he has got such passion and interest and knows everybody who's anybody.
Yes, he does. Yes, and he's still doing the demonstrations at the BAS. That was a very important part of the BAS. I think you introduced those, and that continues. People like to see live demonstrations of microsclerotherapy and foam sclerotherapy, and Philip is Mr. Foam Sclerotherapy in the
Yeah.
UK. Though there are some younger people coming
Oh,
along,
biting at his ankles.
biting at his ankles. Now,
Yeah.
the other thing that was interesting, Emma, was facial spider veins. I didn't know how to treat facial spider veins. And I remember you introducing me to shortwave diathermy.
Yes.
And that is just so good, isn't it?
It's very effective, it's very simple, and it's again very much in demand because just as just as grandchildren, it tend to be grandchildren that comment on the leg veins. What's that on your leg, grandma or grandpa?
Yes. Yeah.
Facial veins, people feel there's some social judgment that it makes them look like they're a drinker or that
Yes.
they've just got very damaged skin, difficult to hide with makeup, that sort of thing. And it's
Yes.
just very simple to treat.
Yes. And again, you and I, we did the first combined leg and face hands-on courses.
Yeah, yeah.
Those were in such great demand. We used to carry the fold-up couches in
Yes,
a transport van and unload everything at the
yeah,
venue, and it was such fun, wasn't it?
it was.
We were young and full of energy in those days.
Yes.
So tell me, when did you leave the BAS board? Because you were the driving force, and you must have left 10 years ago.
Possibly. I think I just got to a point where I felt overwhelmed with all my commitments and I needed to let things go. And I knew it would carry on without me. And that's something I tell myself all the time now. Nobody's indispensable. You can say no to jobs and
Yeah.
prune. I do regular pruning because I'm interested in everything. So my heart wants to say yes, but I have to have a word with myself and say, no, you need to have a life as well beyond work. And I'm trying to slow down a bit.
What have you gone on to do after the BAS? I know you're a serial. You started. How many
I
things have you started other
I
than the BAS?
I started the British Association of Cosmetic Nurses. Similar reasons, really. I just felt nurses needed a sense of community and a voice and to be represented at a political level. So that was the British Association of Cosmetic Nurses. I did my 4 years as chair, got it up and running, and then stepped down to join Save Face, which is a voluntary register, voluntary regulation under the Professional Standards Authority, again, because I thought this is really needed. And then I formed the Aesthetic Complications Expert Group because back in 2010, when that occurred to me, if you didn't actually experience a complication, you knew nothing about them. A complication to do with injectables. So I had to rally around and find people who'd had complications and then bring together a group to learn about them, to publish guidelines and to have some sort of consensus on how to diagnose and manage them. And that took off. So you can see why I'm thinking now, what can I prune so I take something else on, fill the space. But I'm 60 now. So,
No.
yeah. And so I've got to stop thinking of new things I want. Oh, and there was the magazine that you and I pulled together. Do you remember?
Remind me.
So
Oh, yes.
yes,
Yes, yes, yes.
there was no journal for non-surgical cosmetic
Yeah,
practitioners. Nothing.
yeah,
So you and I worked on putting that model together and pitched it to a publisher, and off it
yeah.
went. And now there's about 5 of them. And I remember you saying to me, "Are you sure? You sure this is needed because nobody else has done it?" I think you doubted that it was really needed, and I thought, well, yeah, nobody else has done it, but I think it's a good idea, and I want it.
Well,
So
there you are.
I
You are the
needed your
driving force.
support.
You know, you dragged me along.
I dragged you along. I
in your
will say I
in your
dragged you along for that one.
You dragged me along. No, a lot of it you dragged me along, but a lot of it I followed in your slipstream. I think I'm so pleased that we met. I made that phone call. Who knew back in the day I
Yeah.
think it was 1996 that all these things would have flourished because of that.
Yeah.
The first hands-on course in microsclerotherapy, first training for shortwave diathermy, the British Association of Sclerotherapists, and then you've gone on to do so many different things. I went on to form a very successful CQC registered vein clinic in Dorset, and we did outperform all the local hospitals. We
It
were,
was such a quality service, and you had a really
yes,
fantastic team around you. I was proud to be
excellent.
part of it for 10 years.
Yes, you were providing the
Yeah.
microsclerotherapy for 10 years at the Melbury Clinic Vein Care
Mhm.
Centre. We also together saw the need for an aesthetic clinic. You have your own aesthetic clinic, but we also saw the need for aesthetics in a vein clinic because a lot of our demographic patients were the sort that were also concerned about their appearance and wanted to improve their appearance. So again, you were the lead nurse for the microsclerotherapy, the facial veins, and also the facial aesthetic
Yeah.
treatments that we did at
Anything
that
with a
time.
needle and syringe.
Anything with a needle syringe, and you've also omitted the CMAC. Tell me
Oh,
about that.
yes. So I think that's
What?
one of the most exciting things I've done for me. The ACE group started to be something that I wasn't very comfortable with. It was quite limited in a way. So myself and some of the other board members of ACE Group broke away and formed CMAC, the Complications in Medical Aesthetics Collaborative. And I'll be honest, we came up with that title because we wanted an acronym. The two had to work together. We wanted it to be international because we can learn so much from our peers in other countries. Some of them are way in front of us and some of them are way behind. So we thought there would be there was really a need to bring those different countries together and share experiences and practices. And we wanted to put more focus on education because we were worried clinicians tended to have their head down and not think about complications until they had one. And then they would be in a panic and reaching out randomly for random advice and support. So this was about making clinicians better educated, better informed, and to give them the confidence to work through a diagnosis and management plan independently. But we were there to support if they needed it. And it's taken off, and it really is a global group. We've got over 27 countries represented. We've got different committees. We're going to be registering as a charity, which is very exciting. We have an annual conference and about 1,000 members now. So that's taking off and taking up a lot of my time.
How many members do you have now?
I think it's over 1,000
Wow.
from all over the world. And we've got some branches now. We've got a CMAC South Africa, Ibero-America, which is all the Spanish-speaking countries in the world. They've got one. And we're just about to launch one for Tunisia, which will be Arab and French speaking. So the website's probably going to be translated into 4 different languages: English, Spanish, French, and Arabic.
Wow.
And
Well,
we're going to Chicago for our next conference because there's been such a demand from the States.
I'm in awe of that one. That is amazing. Do you think that's your most successful startup, as it were?
Probably, yes. We probably hadn't anticipated how hungry other countries, because in the UK, practitioners, there are lots of different ways to get support with complications, but there aren't in these other countries. So that's why one
Right.
of the reasons it took off, I think, because of it being such a wow for other countries.
That's fantastic. Fantastic. Is it the what are you engaged in now mostly? Is it the CMAC or is it
I
your own
think
practice?
CMAC is what's engaging me the most. But like with everything else, I'm mindful of getting it to a place where it will have its own momentum, and I don't feel so responsible for it, and I can step back a bit. Because where I'd really like to focus my time is in my own clinic, but I feel like I'm a bit of a passenger in that. I do no marketing; it's all word of mouth, and It's lovely, and I love coming to work here. But I really, and you know me, I've been saying this for decades that I really need to get in the driver's seat, business wise, instead of just being a passenger.
Emma, it's been a pleasure talking to you, reminiscing about the old days when we first met and how things have developed. I'm in awe of your progress, and I'm certainly in awe of CMAC. And I wish you all the best. I look forward to keeping up with everything. Can I persuade you to come to the BAS meeting?
Yes, absolutely. Just I'll need to check when it is, but I do want to come.
Good. All right. Well, hopefully we'll be able to meet in person.
Yes.
Goodbye, Emma.
All right. Thank
I'm
you.
not
It's been lovely to catch up.
great.